Imagine a sudden, terrifying spike in your blood pressure. This isn't just high blood pressure. It's a hypertensive crisis, a medical emergency that can strike with alarming speed and have devastating consequences. Today, we're diving deep into what a hypertensive crisis is, how doctors diagnose it, and most importantly, what you can do to prevent it from ever happening to you or your loved ones. Understanding this condition is the first step toward protecting your health. Let's meet Sarah. She's been feeling off all day, a pounding headache, moments of dizziness, and her vision keeps blurring. She feels confused and has even been sick to her stomach. Sarah is worried. She knows her blood pressure has been high in the past, and she can't shake the fear that this sudden spike could be causing serious damage, maybe even to her brain. Her anxiety is palpable as she waits for the doctor, a feeling many people with chronic hypertension can unfortunately relate to. The doctor enters, calm and professional, ready to get to the bottom of Sarah's symptoms. The first and most crucial step is to check her blood pressure. The cuff inflates, and the numbers flash on the screen in a glaring red. 200/120. This is a clear sign of a hypertensive crisis, that the doctor needs more information to understand the full picture. Next, a thorough physical examination begins. The doctor uses a special light to look into Sarah's eyes, checking the tiny blood vessels in her retina for signs of damage from the extreme pressure. This is called a fundoscopic exam. They also test her reflexes, tapping her knee with a small hammer to see how her nervous system is responding. During the exam, Sarah feels increasingly dizzy and disoriented, confirming the doctor's growing concern. The high pressure isn't just a number on a screen. It's actively affecting her brain function. This is a condition known as hypertensive encephalopathy, where the brain swells due to the sudden, severe rise in blood pressure. The doctor sits down with Sarah to explain the diagnosis. He points to a diagram showing how extreme pressure can force fluid out of blood vessels and into the brain tissue, causing swelling and the very symptoms she's experiencing: confusion, headaches, and blurred vision. This is hypertensive crisis with encephalopathy. It's a serious diagnosis, but the doctor reassures a worried Sarah that with immediate treatment and long-term management, they can bring the pressure down safely and prevent this from happening again. The red warning signs in her mind begin to fade as she understands there's a clear path forward. Now comes the most critical part: prevention. The doctor and Sarah are now sitting together, discussing how to manage her blood pressure for good. The key to avoiding another crisis lies in consistent, daily habits. First and foremost is medication adherence. The doctor explains that her blood pressure pills are her lifeline. They aren't just for when she feels bad. They must be taken every single day as prescribed to keep her levels stable. Next, they talk about diet. It's time to say goodbye to excess salt, which causes the body to retain water and increases blood pressure. This means cutting back on processed foods, fast food, and canned goods. Instead, her plate should be filled with fresh fruits, vegetables, whole grains, and lean proteins. Reducing sugar and avoiding excessive caffeine are also important steps. Lifestyle changes are just as crucial. Regular physical activity, like a brisk 30-minute walk most days of the week, can work wonders for strengthening the heart and improving circulation. Maintaining a healthy weight is also key, as excess weight puts extra strain on the cardiovascular system. The conversation continues, focusing on other vital aspects of a healthy lifestyle. Stress is a major trigger for high blood pressure. The doctor introduces simple stress management techniques like deep breathing exercises, meditation, or gentle yoga. Finding a healthy way to unwind each day can make a significant difference. Another non-negotiable habit is regular monitoring. The doctor shows Sarah how to use a home blood pressure monitor. Checking her pressure at home allows her to track her numbers, understand her body's patterns, and see how her lifestyle changes are working. It empowers her to take an active role in her own health. Finally, they review the warning signs of a hypertensive crisis one more time. A severe headache, shortness of breath, nosebleeds, or severe anxiety. Knowing when to seek immediate medical help is just as important as prevention. Sarah now feels equipped, not just with information, but with a concrete plan. As Sarah leaves the hospital, she feels a renewed sense of control. She's no longer just a patient. She's an active participant in her own health journey. She visualizes her new routine, taking her medication on time, enjoying a healthy meal, and going for a walk. She understands the stakes. We see a quick glimpse of what could happen. Skipping medication can lead to a stroke. But by following her doctor's advice, the outcome is a long, healthy, and vibrant life. It's a powerful reminder that small, daily choices have a massive impact. So, let's recap the essential steps to prevent a hypertensive crisis. First, always take your prescribed medications. Second, adopt a healthy diet low in salt and sugar. Third, make regular exercise a part of your routine. And fourth, monitor your blood pressure at home and know the warning signs. Your health is in your hands. Taking these proactive steps can protect you from a medical emergency and help you live a healthier, happier life. Thank you for watching, and don't forget to follow for more health tips.